I'm Christine Forster, I'm a GP at Freeman's Bay, and Lisa Gray has been a patient of mine for 20 plus years. As a GP, when you have a patient with a rare disease, it is really a partnership over the years, because in the beginning the person will know more than you about the disease, so you learn a lot from them and you are their advocate really. You build up your relationship and you're there for the whole health of that person, not just that. They're not just a LAM patient, they're your patient, and so their physical and mental well-being is paramount to you.
Maybe you should do a chest X-ray.
Going back to that time of diagnosis and the rather uphill battle at the time to get a diagnosis when Lisa was in her early 20s, tell us about that.
The presentation of the disease is something that is really hard because it fits with, we see a lot of respiratory symptoms in general practice. Cough and wheeze is kind of our bread and butter. But the thing is that you're looking for something that isn't following a normal pattern. It doesn't respond to the normal things that you treat asthma with. And I don't think it ever occurred to me that Lisa had LAM, but I knew that she didn't have asthma and she didn't have chronic respiratory infections. So it's looking for a pattern and recognising that this isn't the usual presentation for the disease that you have been thinking that you're treating. And so it is quite a battle, and you have a battle too with your hospital colleagues who only see that person once, but you know them, you know that they aren't just complaining again and again, that there is something that needs follow-up. So that's what I meant before, about we often end up being the advocate because we're in the privileged position of knowing our patients well. So we know when it's not right.
I wouldn't have had today off had I not.
You're in the position of suspecting something is really wrong, in this case not asthma, and the first thing obviously is to send that person off for other testing, bronchoscopy, whatever. How did you do that with Lisa?
Because it's some years ago, with Lisa we did it by referring to the hospital clinic and respiratory clinic and for an assessment, and then once that happens you sort of lose a bit of control, and so the specialist or registrar who sees her who will decide what then is to be done. And I think the improvements in technology have meant that we can actually do it a different way now. If you're worried about someone, it is very easy to talk to a specialist. There is specialist advice at the end of the phone at all of the hospitals, and you can say, I think there's something different and we need a CT or whatever you think, and so you can bypass that first system to get what you really believe this person needs.